Hi there, my name is Chloe. I am your occupational therapist for today. Is it okay if I call you Ashby?
Ash is fine.
Ash is what you'd like to be called?
Yes.
Okay, I'm going to wash my hands real quick and then I'll go over the reason for today's visit. So I looked over your chart and it showed me that you have had a stroke in your left hemisphere. Is that correct?
That is correct.
Okay, can you tell me a little bit about your symptoms?
I'm having trouble getting my full range of motion out of my right arm.
Okay. So you just aren't able to use your right arm as well as you are able to use your left?
Yes,
okay.
that's correct.
Okay. So do you have any pain when you're trying to use your right arm?
On a normal basis, it's at about a 3.
Is that out of 10?
Yes.
Okay.
But when I participate in physical activity, it grows to about a 7.
Okay, about a 7 out of 10 when you're trying to use your arm?
Yes.
So you're at about a 3 right now, though?
Right now I am at about a 3, correct.
Okay, so I'm going to check your range of motion and your muscle strength in that right arm, the shoulder, the elbow, and the wrist. So
Okay.
make sure that you let me know if you feel any more pain or discomfort while we're testing.
Okay, I will.
Do you feel like you need any pain medication right now? I need to talk to a nurse, or are you good?
No, I'm okay.
Okay. So the reason I'm going to check your range of motion and your muscle strength is so that we can just get some numbers and see where you are, so we can get you back to your functional mobility, so you can do things as independently as possible. We can get you home. So first, I'm going to. Can you just raise your arms above your head like this for me?
Okay. I can't get my right arm up anymore.
Okay, so you got your left arm all the way up, but your right arm couldn't come up quite as much.
That's correct.
Okay, if I can also have you just kind of put your elbows next to your body like this, and like you're pouring out a cup of tea. Turn your hands in just like that. Start like this in neutral. Great, and turn your hands in like you're pouring out a cup of tea. Okay, great. And then if I can just have you put your hands like this, and like you're fanning yourself. Copy me. Just do exactly what I'm doing. Okay. So it looks like you can stop now. Thank you. So you were able to get your left arm all the way up. Your right arm didn't quite go as high. And then whenever you turned your hands in, your right arm was able to do it, just not quite as much as your left. And then I noticed we weren't able to flex that right wrist at all compared to your left one.
No.
So what we're going to do first is I'm going to check since you're already sitting up, I'll go ahead and check your muscle strength in that right shoulder, because that's the side that's been affected. So the muscles I'm testing are your coracobrachialis, your anterior deltoid, and your pectoralis major. Those are the main muscles that we use in shoulder flexion, which is this movement I just showed you.
Okay.
So if you will just your right arm, lift it up as high as you can in this motion.
That's it.
Okay, so I'm going to give you a grade of 3 on that one. You were able to flex your shoulder against gravity, just not in the full range of motion. So next I'm going to check your range of motion. I'm going to have to touch your shoulder and your elbow and your wrist. Is that okay?
Yeah, touch.
Okay, so if you will go ahead and lay down on your back for me. If you need any assistance, let me know.
I can do it.
Okay. Perfect, thank you. So I'm going to write down we had a grade of 3 for our manual muscle testing of your shoulder flexion. So now I'm going to do your range of motion in your shoulder. First we're going to do passive range of motion and then active range of motion. So I'm going to raise the bed up so I can reach you better. And I said that backwards, I'm going to do active first. So what that means is I'm going to have you raise your shoulder, your arm just like this, like I showed you before, and do it as high as you can whenever you're ready.
Okay.
That's as high as you can go. Okay,
Yeah.
we got to about 40 degrees right there. Okay, now I'm going to do it for you this time.
Oh, that hurts.
So we can't go any farther.
Yeah.
Okay, so that was about 60 degrees for your passive range of motion. Are you still feeling more pain?
No.
Okay, so you're okay now?
Yeah.
Okay, great. So next we're going to move to the table so that I can check your elbow and your wrist.
Okay.
Okay, Ashby, now that we're at the table, I am going to check your range of motion and your muscle strength in your elbow for pronation first. So again, that's that movement where you've got your arm like this and it's kind of like you're pouring out a cup of tea. So first I'm going to check your range of motion, and again, let me know if you feel any pain while we're doing this, okay? Are you okay right now?
Yeah,
So to check the range of motion, I'm going to put my fulcrum on your ulnar styloid process, just like this. And then if you will, turn your arm in as far as you can whenever you're ready. Great, we got all the way to 90. Let me write that down real quick, you can relax. So 90 degrees for our active range of motion. I'm going to do it for you this time. You put your arm back in that position, fulcrum at your ulnar styloid process. I'm going to do it for you. And we got all the way to 90. Great. Okay. So since I've seen that you can get your wrist all the way to 90 on your own, I'm going to go ahead and apply some resistance and see if you're able to do it against my resistance. So if you can put your hand in a fist, I'm going to stabilize you at your elbow, and then if you'll just go ahead and make that same motion, that pronation. Okay, so you couldn't quite do it with resistance, so I'm going to give you a grade of 3+, because you are able to do it against gravity and full range of motion, just not with resistance. The muscles that you use to do that pronation at your elbow are your pronator teres and your pronator quadratus. Okay, Ashby, so now that we've checked your shoulder flexion, your pronation at your elbow, I'm going to check your wrist flexion. So I did notice in the functional range of motion, when I tested you at the very beginning, that you were not able to make that wrist flexion. I'm going to go ahead and check your active and passive one more time. So if you can, we're going to put your arm on this table. So do you need any help getting your arm up on the...
Maybe a little bit.
Okay. Great. So if you're going to put your hand just like that in that position. Got my body on here. I'm going to put my fulcrum at the medial aspect of your ulnar styloid process, just right here. And if you'll just try one more time to make that wrist flexion movement. Bring your fingers towards your face. Okay, not able to do that? I'm going to do it for you this time. See if I can get your hand up at all.
Ow.
Okay, so there's pain right there. Okay, so we got about 40 degrees. So 0 degrees active, 40 degrees range of motion passive. Are you feeling the pain now?
I'm fine.
Okay, so because I've already seen that you cannot make that movement against gravity, we're going to try it with gravity eliminated. So we're going to turn your hand like this. If you'll sit up straight for me, bend your elbow. Okay. So just kind of bring your fingers and your wrist and your hand towards your body for me. Not able to make that movement either?
No.
Okay, so the muscles that we use when we're doing wrist flexion are the flexor carpi radialis, flexor carpi ulnaris, and palmaris longus. So I'm going to palpate the first two. The flexor carpi radialis is palpated at the base of your second metacarpal. So I'm going to feel for muscle activation there. If you will go ahead and try and make that movement for me. Okay, so I do feel that there's some muscle activation going on right there. So now I'm also going to test the base of your fifth metacarpal at this, right over this bone, the fusiform. I'm going to check right there as well. You'll do the same thing. Okay, so I do feel that your muscles are trying to work in those two areas. So I'm going to give you a grade of 1 for that. Let me write that down. Okay, great. Okay, so I've got some numbers to look over so we can figure out what we need to do in your therapy to get you back home and using your arm and your hand as well as possible and without assistance, as independently as possible. Thank you so much for letting